And is that safe? Not so much, right? These folks can die, right? They can go to DTs and die. DTs is, you know, a fancy word, but basically what happens is the brain, it's sort of geared itself up. It's ratcheted things up a little bit to counteract that depressing effect of that drug. Then you take away the drug, and all of a sudden, the brain is just, it's haywire. It's going too fast. Everything's going too fast. So what do you see? You see anxiety, you see agitation. These folks can't sit still. You see their vital signs go through the roof, so their blood pressure and their pulse are going really fast. And again, you know that's not healthy. You can sometimes see them get psychotic and see things that aren't there, maybe feel stuff crawling on their skin. You can see confusion, shakiness, seizures. Seizures are from too much brain activity. Brain just, and then of course these things can be life-threatening. So these folks can die. So with depressing drugs, you take too much, you can die. You know, and if you take a fairly good dose for a long time and then stop cold turkey, you could also die from that. So I want to make it clear, I guess, on some of these, which ones are potentially fatal and which ones are not. Incidentally, Valium and Xanax and these other drugs, we don't call it DTs necessarily, but it's really the same thing. I mean, the exact same thing would happen if you were taking that for a fairly high dose and for a while, you know, and then you stopped at cold turkey. And the interesting thing is, depending on which one of those it is, like for instance Xanax, it kicks in real fast, but it comes out real fast in your system. So that's really that's one of the highest risk things for withdrawal, because if it comes out of your system really fast, that's when the brain has trouble with it. Something that's longer acting may not, you still may have issues, but it may not be right away, and it may be not as bad as something like a shorter acting pill like of the benzodiazepines, which like Xanax and Valium. Does that make sense? I don't know, I didn't lose you guys. Okay, another class of drugs that are sort of like, they also sort of calm the brain activity down. They're opiates, okay, narcotics. So these would be things like, what's in Vicodin, what's in oxycodone. That's the big one. OxyContin is the one that everybody hears about, talks about today. In the old days, it used to be, it'd be morphine. It's still sometimes now. Methadone's another one. What else? Heroin is another one. In the old days, that was a biggie. These are painkillers, so these are usually prescribed, that some of them anyway are prescribed to kill pain, folks that have a lot of pain. And unfortunately, it's innocent enough. You hear about ball players. They go in, they have some injury, they get on Vicodin, they get on something. They don't know how the brain's wired, do they? Neither does the doctor. The doctor's innocent enough. He says, you got some pain, I know you broke this or you tore that or whatever. Here's some Vicodin. Well, after a while it's not doing it. Here's some OxyContin. Next thing you know, they're hooked. Right? Then it comes out in the papers, they failed drug screening, they're hooked, and this, that, and the other. What's his name? Rush Limbaugh, didn't he get into something like that? So, I mean, you don't know how you're wired, and you get exposed to this. I'm not saying never take a drug of addiction. That's not what I'm saying. So, if you have pain, I'm not saying don't ever take any kind of narcotic pain pill. But certainly, if you have a family history of somebody who had in your family who had trouble with alcohol or addiction of some kind, tell the doctor that, will you? Because then the doctor will say, oh, okay, well, maybe we'll need to kind of keep an eye on you. Here, I'll just give you this much. And, be honest with the doctor. If you ever had a history of addiction to alcohol or cocaine or something else, and then you have an injury and you have pain and you need some pain pills, you still need the pain pills, that's okay. But you got to tell the doctor, I had a history of addiction to this, this, or this. So he knows, or she knows, to watch out for that and kind of monitor you close, and things don't get out of hand, okay? Another sort of digression here. These opiate drugs, what do? They kill pain, obviously, but they also are kind of calming. So they can be sedating. So you got to be careful, like I said, with driving and things like that. They can cause constipation because they slow down the bowels. They can decrease your memory, maybe some confusion, some slurred speech, maybe have a hard time paying attention. Your judgment may be off, and they can make the pupils really small, which is just kind of an interesting little thing. I don't know why I told you that, but just so you know, you see somebody with really teeny tiny pupils and it's a really bright day or really fairly dark room, and you kind of wonder, what's going on. It may be not that, it may be something else. But now, what happens in overdose? Obviously, overdose of these things. What happens? We just talked about that with the other depressing drugs. You can suppress the respirations, the breathing. So these folks will sometimes, they can die basically from overdose of these drugs. So that's overdose. It's just everything gets worse, except that you could potentially die. The withdrawal, on the other hand, is sort of the opposite of all those symptoms I just mentioned. So instead of sedation, you're awake and you're jittery, you're shaky. Instead of constipation, you have diarrhea, maybe. You get a runny nose. You can have increased pain instead of decreased pain. Muscle aches, nausea, vomiting. Again, it has to do with the bowels. And the pupils can dilate, which obviously it's the opposite of what happens when so withdrawals is the opposite of the overdose or the actual effect of the drug. Now, interestingly enough, usually the withdrawal from this is not deadly. It doesn't feel very good, as you can imagine, having all these things. People feel quite miserable, but they usually won't die from it. So that's a good thing. Almost done here. I got hallucinogens. I'll just real quickly cover, like LSD is kind of the classic example of that. And these drugs make folks, like we talked last time about psychosis, hallucinations where you see things or hear things that aren't real necessarily, may not be real, and delusions where you think something's happening that isn't. Okay, that's a hallucinogen. That's things like LSD. Ecstasy has a little bit of properties like that, but also a little bit like a stimulant. These folks, they can sometimes have anxiety. A lot of times, they feel sort of unreal or detached from themselves. Sometimes paranoid. Paranoid, they can get shaky, sweaty, have chills, mood changes, and impulsiveness. The overdose is usually, it's just a really intense psychosis. And these folks, unfortunately, sometimes these folks go on in their lives and have trouble with either really bad flashbacks or frank psychosis. I've seen cases, and I don't know, well, I've seen cases where a young person will use LSD and then have trouble with psychosis from then on. And without treatment, they continue to have psychotic episodes. What I don't know is, are those folks that would have already been at risk to have schizophrenia anyway, or something like that anyway, psychotic illness anyway? They might have been, and maybe the LSD threw them over. But like we've talked about, all of us can become psychotic. Well, maybe the LSD made that person get psychotic once, and we talked about with schizophrenia that once you've been psychotic, it's easier to get psychotic again. So maybe what we've done is that the person's threshold for being psychotic was here. They took LSD and it dropped, and then from then on they had trouble with psychosis. That's possible. I don't know for sure. Then marijuana, cannabis. There are receptors in your brain, cannabinoid receptors, and cannabis is sort of here. Cannabis is the chemical name for marijuana, and then cannabinoid receptors already exist in the brain. And it's kind of interesting. I don't know why that would be, but they're there. And I don't know much about them, but I do know that obviously there's been some interest in medicinal uses of marijuana. So it can block things like nausea, and they use it sometimes in cancer patients and all. But when you're high, you can get disinhibited, kind of euphoric, and it's interesting with marijuana because some people experience it in a really good way, and other people in a very bad way. And it's sort of I'm sure that has something to do with the way their brain is wired to start with. So you'll see some folks who'll use and they'll be paranoid as heck, and they'll say, "Man, I don't want to use that ever again." And other folks, "God, I love that stuff," and they're high, and it feels really good, So it's interesting. That has to be something that's different in the brains of the folks that are using it. It almost has to be, or could be the stuff that they're using, or if it's laced with something, I suppose, is one thing. But these folks, when you're using, I said euphoria, anxiety, and some people paranoia, but poor judgment, attention, slow reaction time. Again, this can interfere with driving or doing a job where you're working on some machine or something. Illusions, hallucinations, increased appetite, call it the munchies, dry mouth, feeling unreal or outside oneself, just sort of like the LSD experience, where that's called like derealization or depersonalization, sort of unreal. Things are unreal, or I'm outside my body watching things from a distance. As far as I know, there's not a huge issue with pure marijuana in an overdose situation. These folks will not usually die. The effect of the drug is just intensified. And the withdrawal is usually not deadly. It's, these folks can get more anxious and have craving and different things, but it's not typically as bad as some of the others. Sweating, tremor, things like that.